Good morning, everyone. Welcome to the Insurance and Real Estate Committee's Insurance Fund Working Group. This is Wednesday, July 17th, 2024 at 10 a.m. And we are convening the meeting. Any remarks from any of the attendees? Great, we'll move on to number 3 on the agenda, which is review of Special Act 24-15. This sets up the goals of the working group and the appointees and direction of where the working group will be going throughout our meetings. And one of the things that we have to do is appoint a chair and co-chair of the working group. Do we have any nominations?
Thank you. I would like to appoint the 2 chairs of the insurance committee as chairs of this committee. Kerry Wood and George Cabrera. Is there a second? It's been seconded. Does anybody have any objection? So all those in favor of appointing the 2 insurance chairs as the chairs of this committee indicate by saying aye.
Aye.
Any opposed, any abstentions? Motion carries. Madam Chair.
Thank you. And we will also appoint a vice chair at this time. And I make a motion to appoint Senator Kathy Austin as vice chair. We have a second. Any discussion? We'll take a vote. All those in favor signify by saying aye.
Aye.
Opposed? And we have a vice chair. Moving on to point 4, which is goals of the task force. I will jump down to that section. So the goal is in section F there. Not later than January 1st, 2025, the working group shall submit a report on its findings and recommendations to the Joint Standing Committee of the General Assembly, having cognizance of matters relating to appropriations and budgets of state agencies and insurance. In accordance with the provisions of section 11-4A, the working group shall terminate on the date that it submits the report. So what we will be planning on doing is having additional meetings throughout the summer, fall, and make sure that report is ready by January 1, 2025. Next on the agenda is a review of the insurance fund budget. Everyone had the legislative brief that was sent around. Please.
Madam Chair, if we could go back to make sure that we have enough people that are appointed and identify the people on the committee. So we have the working group, the chairpersons and ranking members of the joint committees of the General Assembly having cognizance over appropriations and budgets of state agencies and insurance or their designees. So do you know if the ranking members have been informed of the meeting? Ally? Could you just make sure they know that when we're give them the schedule of the meeting? Thank you, Ally. The insurance commissioner or the commissioner's designee? Do we have someone from the insurance committee?
Yes, this is Jane Callahan from the insurance department.
Thank you. And have you gotten all the documents that you need that we have done so far?
I received the agenda for today's meeting thus far.
Thank you. And one representative of an association of property and casualty insurers. Eric?
Yes, Senator, that's me, Eric George.
One representative of an association of health plans. That's you.
Susan, and then it's Susan, and then I'm filling in for her. But
Thanks.
Susan helping.
Thank you. 2 chairpersons of the joint committee having cognizance of, we have all of that. And then we have one more member, CBIA, if you want to identify yourself.
Wyatt Bosworth, Associate Counsel at CBIA.
Thank you. And so then we have our members, and these are who we're going to take into account for drafting the report. So everybody take good notes. Okay. There you go.
Great. Point 5 on the agenda is review of the insurance fund budget. We have a brief in front of us. Just as background, the insurance fund was originally established to provide the insurance department with resources and staff necessary to achieve the National Association of Insurance Commissioner, also known as NAIC accreditation. The assessments and fees have increased since that was established in 1991 to a larger number that we have today that is also in the second paragraph there. We also have some additional assessments and fees that are described in this report. Is there any discussion on these fees or any questions?
Madam Chair, this is Tony. I just want to say that I do not have the budget. I did not get the budget on documents that for some reason it was not sent to me. I looked, who would have sent it? Ally, who would have sent it?
I think I sent it to you, but I will send it to you again right now. It's just Taylor's gonna send it over. Sorry about that.
Okay, thank you. Thank you very much. Thank you. Sorry, Madam Chair.
I think as part of the discussion moving forward that we would like to look at the history of the budget, how it started, where the funds were being used to, and where we are today. I think that would be a good discussion to have in future meetings. We should also look at, I think, where the money is being spent regarding being related to insurance, if it is an insurance assessment. I would like to hear from other members of things that we would like to cover in the working group as well. Senator Ralston.
Thank you, Madam Chair. And so I did get a document that I think I sent to you, Ally, maybe not, which is the spreadsheet. I'm going to send it to you right now. That is directly out of the budget. And I think we have to look at the numbers because Representative Walker and I have been noticing that the groups that are funded and the agencies that are funded by the insurance fund are growing exponentially. And we want to make sure that we're not overburdening either the health policies or the property policies without an understanding of what we're doing. What is the impact on the individual who has a health policy or property policy? What is the impact on the overall costs? These are things. So I will send this to Ally and then she can send it out to everybody, which will give us another document to look at that's in the budget. And I'll send it directly to you too, Tony. And
Thank
I think we had someone else join us. Might want to ask Mr. Carson.
Where is he? Oh, Jim Carson, would you please identify yourself?
Hi, Jim Carson, Legislative Program Manager for the Insurance Department.
Thank you for joining us. Christine Cappiello.
Yeah, as we're looking at things, I think Senator Austin alluded to it, but I think that it's important when we go back and look at the history. It was in 2000, would have been about 21 years ago or so when a whole bunch of general fund programs from the Department of Public Health came into some of these assessments. Previous to that, it was really funded. I think the insurance department was the only thing that was funded out of the plan. So I think if we go back, we need to go back about 20, 21 years, maybe 22 years, I think is when that change was made. So I think it's important for us to go back to when the changes started. And the other thing that Senator Austin alluded to is that I think it's important for those that don't know that this is funded by the individual policyholders, that they are the ones that pay the assessment through a collection of the insurance carrier. So I think, and that's unique I think to the way some of these other assessments across the country work, but also the way some of the other programs work in the state. So I just think when we do a look at it, we need to go back pretty far. But I think we also need to maybe do a correlation of how much the policyholders have been increasing in paying for this.
So we were just discussing offline that going through the budget will be something that we'll do at the next meeting. And we can also get some historical information as well. I also want to add that I think we should also look at, there's health policy and there's property and casualty. And I think we should look at the distinction and understand that as part of this fund as well. Eric?
And just to add on that, I just wanted to thank both Representative Wood and Senator Austin for the work that you've done advancing the discussion, specifically from my members' points of view. Those public health related agencies that are paid for in part by PNC plans, PNC policies. So I wanted to thank you for your work here, and I appreciate that. And this, I guess, I think it would also be important. I'm sort of speaking beyond myself here, but I would believe only fully insured plans, fully insured policies would be bearing the cost. Self-insured.
Well, sort of.
So yeah, I think that's
There are, I think
I'm
that's
thinking about this. That's something we're going to have to,
Yeah.
look into, and I'm sure you know exactly
Yes.
what I'm referring to here.
Yes, when you look at the history of it, there are some, most of it, and Jane obviously and Jim Carson know this very well. Most of it is covered by the fully insured, but there are some that, like the immunization fund, that are covered, that are paid for by everyone. We call it belly buttons, right? So it's self-insured and fully insured. And then there are some of the others that are paid for by the self-insureds, but not the TPAs. So it's almost, it's become very confusing, which I think is what's added to the confusion of how this whole thing works. So we're going to have to maybe parse out what's paid for by by a fully insured policyholder, what's paid for by the self-insureds, what's paid for by the TPAs, and what you're allowed to do and not allowed to do.
Eric?
That makes perfect sense to me, what Christine just said. And just adding on, I think you're going to learn as you scratch into this, that this is an extremely complicated and confusing issue that is touched upon by numerous parts of state government. And that it has evolved in a way that is not crystal clear and not fully, I think I would argue, not fully transparent as to how things work.
So it sounds like we will do some offline work on the historical budgeting of this and make sure that that gets into the hands of the members prior to the next meeting so that we can have a review of that and have a more comprehensive discussion rather than just learning about that at the meeting. Senator Austin.
Thank you very much, Madam Chair. So I have talked to the document that I sent around to everybody whose email I have on my phone. And okay, good. It talks about the insurance fund paying for people at the Office of Policy and Management, at the Department of Administrative Services, at Regulation and Protection, the Insurance Department, obviously, the Office of the Behavioral Health Advocate, the Office of the Healthcare Advocate, Conservation and Development in the Department of Housing. That's the Crumbling Foundations, Healthy Homes component, the Department of Public Health, the Needle and Syringe Exchange Program, which is one of the programs that you were talking about, the Children's Health Initiative, AIDS service, breast and cervical cancer detection and treatment, immunization services, X-ray screening and tuberculosis care, venereal disease control, the Office of Health Strategies, which is grown quite a bit. The Department of Mental Health and Addiction Services, a managed service system. The Department of Aging and Disability, Fall Prevention, and the State Comptroller. So when we're looking at the numbers, really, 13 million is the Office of Health Strategy. Programs and initiatives are 46 million in the Department of Public Health. That's a large dollar amount. The Office of the Healthcare Advocate is 4 million. And the next largest one is the Insurance Department, 35 million. So I think that when we're talking about this, to figure out what the costs are and where they are, I'll get in touch with OFA and LCO to say, when did these expenditures come on this budget, what year, so that we can figure out the parsing out of that. And if that's okay with you, Madam Chair, I'll have them do that. Okay.
All right, any other discussions on the working group and review of the budget? All right, we will move on to number 6, which is review of the insurance funds in other states. An OLR report was sent around. There was only a few states, Colorado, Montana, New Mexico, Ohio, and Rhode Island. I think this is just good information to look at. This doesn't necessarily mean this should be a model for Connecticut, because these are extremely different. We really don't have anything that we can compare to for Connecticut. But this is just good to know about how other states do it. I think that we can certainly, review some of this, but Connecticut is a much more complex system. So that was sent around. We could, any other discussion on the OLR report? Okay, let's move on to number 7, which is discussion of deliverables for next meeting. We have already discussed about having a historical budgetary review of the insurance fund as one of the items. Ally, what are some of the other items that we discussed for next meeting? I'll just put it out to the group. What are some other deliverables that we'd like to have into the members' hands before next meeting? Do we want to stay focused on the historical review of the budget?
I think that's going to take a long time.
Okay, so we'll
Yeah.
stay focused on that. We'll get that out to everyone prior to the next meeting so that we can review it and come ready to discuss.
I think that probably questions will come as we learn more. And
Mhm.
as we peel the onion, I think questions will sort of present themselves.
Okay,
I think it'd be helpful too as a benchmark moving forward. I know the carriers had worked on a document a couple of years ago about the PMPM costs of the assessments on policyholders, and it would be interesting to know what that PMPM cost is today. Because anything we do with the insurance fund here, whether it be reducing it or, putting state dollars where the assessment was funding things, would result in a reduction in premium costs for policyholders. So I don't know if that's information that the carriers have readily available, but if not, yeah.
Yeah, I think we do. I think it's old. I think it's a couple of years old. And then there was we were just discussing this kind of wonky thing that happened with the immunization fund in 2020 because of, actually it was in last year's budget, but it was a reflection of people not getting as much vaccines in 2020 and 2021. So I do think we have to when we look at the budget, we do need to kind of take that little moment in time where there was a big drop and just know that that's because people weren't getting as much on the immunization side. And it's back to where it should be in terms of the dollar amount. But I think we do. And I think we can update it. I think it's a couple years old, I think.
is that something that can be updated Like, what's a time frame for getting an updated?
I'll have to check with my other counterpart carriers, but I don't think it's, might be speaking out of turn. I don't think it's a big lift. I think by the next meeting, we could probably provide it.
Okay.
And I will also be reaching out to my guys, my domestics, to see what, it's done differently. We're not per member per month. It's just not how it's calculated. But I'll see what we can find. And would be important to know when we plan on having, how often we're going to be meeting. Is it going to be once a month, twice a month, at a different rate?
All right, so I think that's a good end of the discussion for deliverables. Why don't we talk about setting meeting expectations?
Thank you. In looking at this, I just want to just go back to the chairs and vice chairs, and while you have a Senate chair, and I have a partner that I use a lot in the House who has always been working on this issue for me for the last 2 or 3 years in appropriations. We've been working in, Madam Chair, with your acquiescence. I'd like to recommend that Representative Walker, who is a key partner in this, be the House Vice Chair, if you're okay with that.
Yes.
Is everybody else okay with that? Great. And so Tony, you are now Vice Chair.
Thank you, Kathy.
You're another committee to be part of, but I wanted you here. And I think that we have to meet at least once a month, and we may meet towards the end more than that, but at least at the beginning, we have to meet once a month, because we do have to get the documents together. And so it's going to take LCO a little bit of time to get an historical review of the spreadsheet together. So I do think just doing that and then getting that out to you so you can all review it ahead of time, I think is important. And I think when people start seeing the different changes in the years on how much we're adding into the insurance fund, I think that will show us dramatically why we need to have this discussion. So that would be my part of this discussion.
Madam Chair, may I just pipe in? Thank you for nominating me and giving me more things to do. I love it. I just want to say also that I agree that we have to meet at least once a month to go over the documents, especially in the beginning as we gather the information. And then once we've gotten the information, we can probably make sure that it's just once a month. But in going forward, maybe it's every couple of weeks as we gather information. I think the budget is critical. I think the statutes, that how we developed this and what the purpose was, because it's obviously veered off from what it originally started in the beginning. And then what are the values for the state of Connecticut in going forward with that? So I think this is going to be a long discussion for a little bit, at least for the first few meetings, so that we all get on the same page. So I look forward to it. Thank you.
Thank you, Representative Walker, and thank you for putting together the working group. I know that you've played a big role. All right, so we will move on to setting a date and time for the next meeting. I just looked at about a month ahead of time, and that puts us into the week of August 19th. Any dates or times that work well for people? We are meeting on a Wednesday today. Do Wednesdays at 10 a.m. work? Would August 21st at 10 a.m. work for everybody? Okay, we'll set the date for August. Does that work for you, Senator Austin?
Yes, it does.
Representative Walker, does that work for you? Okay, so Wednesday, the 21st at 10 a.m. will be.
I'm sorry. I was muted. I just want to make sure, because we start our CDBG meetings and everything in August, and we have LIHEAP in August. We have a lot. So I just want to make sure that this is not a time that we have been logged out. Kathy, are we clear on that day?
Yeah, we have holds for the Thursday and for
Okay.
other days, but nothing on that Wednesday.
Okay, great. Then I'm good. I'm good. Thank you.
Perfect. So we'll do August 21st at 10 a.m. for the next meeting. And any other comments or questions? Do we have a motion to adjourn?
I'll make that motion.
I second.
Thank you, everyone. Meeting's adjourned.
Thank you.